Good evening, everyone. Welcome to the North Somerset Council Facebook page, where we're doing a live question and answer session with members of the council's executive, so some of the leading councillors. My name's Mike Bell. I am the deputy leader of the council and the exec member responsible for adult social care and public health. Oh, and by the way, we like to do the party labels on this one just to show our multi flavour. So I'm a Liberal Democrat, and I'm going to invite my colleagues to introduce themselves. So since this is his debut Facebook Live, Mike Solomon, would you care to introduce yourself?
Yes, I'm Mike Solomon. I'm recently appointed as Executive for Tourism and Leisure and things like arts and culture, so I'm part of that brief. And I'm a member of the Independent Group.
Lovely, thank you, Mike. And Don, please, next.
I'm Don Davis, a leader in North Somerset Council and also a member of the Independent Group. I think we've got Matt turned up as well now.
Yeah, I've spotted him. Thank you, Don. And Catherine, please, next.
Hello, I'm Catherine Gibbons. I'm the Executive Member for Children's Services and Lifelong Learning, and I'm the Labour Councillor for Milton and Weston-super-Mare.
Thanks, Catherine. And last but not least, amongst the elected members, Mark.
Good evening. Yes, I'm Councillor Mark Canniford. I am the Lib Dem Councillor for the Hillside in Weston-super-Mare, and I'm also the Executive Member for Business and Economy.
Great stuff. And in addition to the lineup that we've got tonight, we have several other exec members, but we're because we've got a fairly large team and a lot to get through, we're going to sort of flex the turnout at these Q&As each time to try and reflect what we think are likely to be the key questions. So we're expecting tonight to be a bit of a COVID-19 and public health and business support special, so hence the lineup we've got. And we're also very pleased to be joined by our Director of Public Health, Matt Lenny. Would you like to say hello, Matt?
Hi, good evening, everyone. Sorry I was slightly late joining there, a few technology issues, but yeah, I'm Matt Lenny, Director of Public Health, and pleased to be here.
Thanks, Matt, and I'm glad you shifted your position as well, because you had a spectacular halo when in your initial position on the camera there, which is very appropriate given the work that you're doing for us in the council. Okay, so obviously it's bonfire night, so we're not expecting a huge turnout in terms of people watching online, and there'll be a few sound effects in the background, I suspect, as people start to set off fireworks in various parts of North Somerset. We're all obviously in compliance with the national restrictions, doing this from home this evening, and I hope that people are coping okay with the restrictions so far. I'm sure that we'll have some questions on those in due course. So I thought it would be useful perhaps if just to give us a quick flavour before we get into general questions through the Facebook page, and if you've got any questions, just put them in the comments below and we'll pick them up and try and get through as many as we can. I thought if Matt, maybe you wanted to just give us a quick update on where things stand in terms of COVID cases in North Somerset at the moment, and where we are with the restrictions that have come in force today.
Thank you, Mike. So just to give a brief update on the numbers. So our rate per 100,000 population at the moment is 171.9. That's as of the end of yesterday. That compares, that's slightly above the Southwest regional rate, which is 145, but is below the England rate, which is about 220. So our numbers of cases and our rate of cases has gone up. So we're seeing about just over 50 cases a day at the moment, which is quite a considerable increase from where we were about a month ago. But that's in line with the rise both across the Southwest and across the rest of the country as well. In terms of the cases, we're not seeing any one significant place in which the cases are coming to us from within North Somerset. Lots of them are individual cases or primarily related to households. So a cluster of individuals within a household being diagnosed with coronavirus. And the age profile is changing over time. About a month ago, we would have said it was primarily amongst younger people. And that's still the largest single group of people with COVID-19 positive cases. But we are seeing a spread into across the whole population, so into older age groups which is something that's of particular interest and concern for us, because of what we know about the fact that that can have much bigger health impacts for people as you get older, and particularly for those people who might be also experiencing long-term conditions as well, things like asthma, diabetes or heart disease. So overall, at this stage, the new national restrictions is something which we think is quite helpful. We were already considering what we might need to do extra in terms of the tier structure. But what we want to do is try and use this lockdown to help arrest the rising cases, bring that number back down as far as we can, and then think about how we can continue to re-engage with people locally, be really clear about the behaviours that help to stop further spread. So back to the hands, face, space message, but also just think really carefully about how we move around our community and reduce risk of further transmission. So that's a broad overview, but very happy to take some questions as we go along.
Thanks, Matt. That's really helpful. So we had a few questions in advance, which I'll go to first. So the first one is for you, Mark. Kenny in Weston would like to know what sort of business support is going to be available this time as we go into these new national restrictions.
Hi, Kenny. Thanks for the question. Yeah, there is support. North Somerset are really keen to make sure we get that support out to you quickly. Now, I think what we need to say is that the support is for those businesses that are forced to close and those who are severely impacted by the lockdown. So if you can continue to trade, it's not like last time. You won't. It's not a blanket grant. So those who are forced to shut down or their businesses are affected by the lockdown will be getting up to £3,000 as a grant, which will depend on your rateable value again, as it was around the first time. But of course, you've gone through the process as you have previously. So we do know your details, we've got your bank details, so we'll be able to pay this out much quicker, much more effectively, and we're looking at paying this out from the 16th of November. We will, though, require those who need it to simply write into us via email, simply because we do have to have some form of request to deal with this. And then, of course, we also have a discretionary grant fund, which the government has given us, but we are still working on that. They haven't given us all the parameters and details, but again, it's there to support businesses over the longer term during the lockdown or during a different tier when we come out of lockdown on the 2nd of December. So yes, we will be supporting you. Yes, we are looking at all sorts of business. All executive members and councillors will be happy to hear from you if you have concerns and you need our support. But there are other supports too. So if you're looking at setting up a new business because your life has significantly changed because maybe you've been made redundant, we also have universal business support available to you free of charge, which can help you with all the things that you need to get set up in a new business. So there are lots of things available. You can pick up a lot of that advice in northsomerset.co.uk. But we are there to help. It is on its way. We will be, I think, releasing details tomorrow, so keep an eye on the North Somerset Facebook page, web page, and we should be able to get the details to you, and you'll be able to get back to us with the details that we need. As I reiterate, fewer details than last time, but there will be money on the way for those who are severely affected.
That's great. Thanks very much, Mark. And the next question is from Claire in Portishead, and I'm going to direct this one to you, Mike. And it's about leisure centres and libraries. Are they going to be closed? What services will be available for the community during November, during the period of restrictions? And is anything going to be available online?
Yes, unfortunately, the leisure centres, other venues, entertainment venues, the Playhouse, theatres, cinemas, gyms, they are all going to be closed. I think there are some facilities that can open for elite sportsmen that would need to train. There are some exclusions to cover that. So all our leisure facilities, unfortunately, will be closed. The libraries, although the doors will be closed as such, they'll still be taking bookings for use of computers, etc., and online services. that's my understanding so far.
And I think the library service will have click and collect services.
Yes, I'm sorry, I forgot that. And they will obviously continue with their click and collect, Mike. Yes.
Yeah, brilliant. So, and certainly do keep an eye out on the council website in terms of any changes to our services. But it's going to feel different to the last lockdown because a lot of the services are remaining open. And that leads me directly to the next question, which I'll ask you to answer, Don, if you don't mind. Which comes from Carl in Nailsea, who wants to know whether the recycling and household waste centres will be shut this time, and what's happened with the number plate system.
Hiya, thanks, Carl. Well, under government instructions this time, the recycling centres can remain open, and they will remain open, and we will continue with our normal curbside collection across waste and recycling. So hopefully from that point of view, there should be no restrictions. And my understanding is that we are now about to stop the odd and even numbered system for arrivals. I would do double check on the website, because I guess if we suddenly have a large surge of demand again, we may have to reintroduce them. So don't get caught out like I did a few weeks ago and go out without checking the website first. So I would say we're endeavouring to make it as easy as possible, but I think we also have to bear in mind that we have to keep not only the residents of North Somerset safe at the recycling centres, but also our very dedicated staff. So we need to make sure social distancing is maintained across the piece, and we may have to reintroduce measures if there's a sudden surge in demand. And I would say that we are expecting, both on the curbside and the recycling centres, quite a lot of extra demand, because clearly with Christmas coming, many retailers being closed because the government lockdown, many more people will be shopping online, which by design then increases the amount of packaging materials that come through, and again, people want to get them away from their properties. So our recycling teams are very much aware of the fact that the extra volume, and also in the recycling centres. I hope that answers your question. Thank you.
That's great. Thanks, Don. And Mark, you wanted to add something?
All I wanted to add, Mike, is something which is quite close to me. If you do shop online, just consider that on the 2nd December, you can go back to your high streets and shop, save all the rubbish, save our high streets. You don't have to do it online. Put the money on the side and go and spend it in the high street and enjoy Christmas if we come out of the lockdown. Or when we come out of the lockdown.
Yeah, really good point. Thank you, Mark. So the next question is for you, Catherine, and it's from Mary, who would like to know what the arrangements are in terms of childcare. So if you can't work from home and you therefore need to leave home and you've got childcare issues, what are the rules? What do the rules allow, and particularly in terms of support from family?
Right, sorry, am I on? Yes, I'm unmuted, aren't I? Yeah. Well, wraparound childcare can continue to operate as long as its primary purpose is to provide registered childcare. So depends really on what sort of childcare Mary's been relying on. We were discussing earlier the issues around grandparents looking after children and things which are becoming problematic. But any kind of normal childminder or early year setting will continue to operate as normal, and she should be reassured by that.
Okay, thanks, Catherine. And I've got a question from Matt on the Facebook page, which I'm going to throw at you, Mark, because it has a vaguely community safety relation, and Matt's question is that he's concerned about the speed of traffic coming into Weston on the dual carriageway down Somerset Avenue. Obviously the speed limit has been increased for large parts of it to 60 miles an hour, and he's worried that that's encouraging people to push the boundaries, particularly obviously because it's dualled. Has the council given any consideration to this, and perhaps either reducing the speed limit or perhaps installing speed cameras or average speed cameras there to encourage the right behaviours?
Thanks, Mike. Yeah, I think just for a quick history lesson, the speeds were reduced about 4 years ago around the Morrisons area, but you're quite right. You get past that roundabout and then, Matt, people tend to plant their foot again, don't they? in terms of some restrictions, I think that speed cameras can work in the right place, and this may be one of those places, and we'll have to look at that. The council currently isn't a great supporter of speed cameras, but if they actually have a purpose, which is to slow traffic, then they have a really good use, and I think that's something we could consider. You're quite right, people do go down there too quickly. There seems to always be a race. Unfortunately, people think 60 miles an hour is the speed you have to go and not the maximum speed you should be traveling. So I'll take that away. I will talk to my colleagues around what might be able to be done, but it's a really good point, because I've seen it myself where I've been tootling along at a decent 50 and people just shooting past. So leave it with us and we'll see what could be done.
That's great. Thanks, Mark. And there was also just a comment, which I will mention, from Martin on the Facebook page, which is just about saying well done to the local health service and hospital and for all the work they've been doing. And I think we can't say that too often. And I think it's particularly worth remembering at the moment that this is a difficult time of the year for the NHS under perfectly normal conditions. The winter pressures has become a phrase that's got into our normal usage every day because of the pressure that we know is experienced by the NHS at this time of year. And obviously they've got to balance that now against all those additional pressures of COVID. And we absolutely, as Matt was saying earlier, are seeing more cases locally, and that's translating into more older people, more vulnerable people impacted by COVID, and that means more people in hospital as well. So I think, it's absolutely vital that we all do the best that we can to protect the NHS, because they will not be in the same position to respond to it as they were back in the spring. So let's just keep thinking about how hard they're working all the time for us to protect us and keep us safe and healthy, and do the right things. So I've got another question, which I'm going to throw at you, Don, if you don't mind, which is just asking about, it's from Donna, what about people who are having problems paying their council tax? And she's particularly citing problems around the information centre being closed on the Bourneville estate in Weston. What can people do? What sort of support and help can they expect from the council?
Well, I guess the first thing to do is to check that, Don, that there's no support through the council tax support scheme, which is available for people whose incomes have been much reduced. The other thing, I guess, is important as possible is to speak to the council. It is able to, the telephone number for the call line is 01934 888802. I think it's important to engage, because clearly we want to make sure that nothing is then done to make the issue even worse, in terms of people then chasing for council tax when we need to know that people need the help there. The Citizens Advice Bureau is offering online support as well. And I know colleagues here, I think Catherine is involved with Citizens Advice. So there is help out there, but clearly for reasons which I'm sure you can understand, a lot of that face-to-face activity is no longer deemed appropriate for the safety both of the people asking for the advice and those receiving the advice. I don't know whether, Catherine, you want to make any comment from the CAB point of view on it. I know you liaise very regularly with them.
Yes, I do, and I know that they're doing a sterling job in delivering advice online. So if anyone does have any issues, just because they're not open for their face-to-face appointments and contact, don't hesitate to get in touch, because you will get through to somebody. And I know from personal experience how much training the advisors get and how much experience many of them do have. And there are a range of experts on hand as well. So it is a hugely valuable resource for residents who don't know where else to turn. So please, do get in touch, especially over council tax issues and anything kind of legal, they can help. I often get asked questions as a councillor or as a ward councillor. I have to remind people that we, as councillors, cannot give legal advice, whereas up to a certain level, an organisation like Citizens Advice can. They are empowered to do so, but we're not. I don't know if that's helpful. Hope so.
Thanks, Catherine and Don. And I think the key message is that if anybody out there is in difficulties with their council tax, keeping up with payments, please just get in touch with the council. Telephone numbers, email is on the website. We're clearly going to be very sympathetic to people's situation at the moment, and if you are in financial difficulties, please get in touch, because there is all sorts of support available. So let us know and we'll do our best. I've got a question from Marie, which is about what's going to happen, particularly in terms of the on-street pay and display parking zone in Weston Town Centre, and concerns that with people being told to stay at home, how easy will it be for them to move their vehicles and access parking? So the arrangements are going to be slightly different this time in terms of parking. So we won't be closing car parks or changing the charging system on pay and display or in off-street car parks this time. And the reason for that is that obviously a number of businesses are now still able to operate lawfully, and some people will still be accessing workplaces and visiting both essential and for click and collect services at some shops. So parking will essentially operate as normal, but what we will be doing is being more relaxed around enforcement issues. So if you live in the pay and display zone and it's difficult for you to move your vehicle on a regular basis, or you've got problems on that, just put a note in your car and we'll take a more sensible view around enforcement during the national restrictions, because clearly what we don't want to be doing is encouraging people to go out and about just to move their car around the corner every couple of hours. So hopefully that sort of common sense approach really will help people over the next few days. On the issue of shops and businesses, Gemma's asked that there's a bit of sort of lack of clarity about who can continue to trade and who can't. And some people have been suggested that they can check with trading standards for advice on that. Anything that you want to say on that, Mark, first, in terms of who can trade and who can't?
Yeah, I think that's a double act between me and Matt, actually. But non-essential. If you're non-essential, I don't know what is it you do, but if you sell food, groceries, if you a hardware store, you can trade. But I'm afraid if you're selling jewelry, shoes, clothes, you can't. I mean, it is very frustrating for many businesses, because I think it's something which I've highlighted quite a bit recently, is that the supermarkets can carry on doing these things and our local businesses can't, and it's simply not right. And we can't change that. Government has set those conditions. We would love to be able to have more local control on what's happening, but I think Matt can add to some of those. But if you're non-essential, you can't trade.
Thanks, Mark. I don't know if you've got anything to add. I mean, there's slight caveats to that, isn't there, of course, because you can still operate online services and you can still operate click and collect services, even if you're deemed non-essential. And going out to access those things is still permitted. But Matt, and where should people go for advice if they're not clear?
Well, that's what I was going to point to, actually, Mike, because I think that's the easiest thing to do. So it's on the gov.uk website. I would say if anybody has, and hopefully lots of people have, downloaded the Test and Trace app on their phone, it's a really quick way of getting to the government advice, because when you open up the page, there's a little link on there that takes you direct to the advice that is new for today, and that has a rundown list of the types of businesses that can and can't operate, and, as you say, the circumstances in which they can operate as well. So I would advise anybody to look through that and to try and identify their business. But as Mark said, there's a clearly defined list there. It's not under local jurisdiction, and people will just need to make sure that they're following those rules carefully.
And absolutely, if you're unclear as a business owner or a business operator, contact our business team or our trading standards team, and we'll give you whatever advice we can. Don, were you signalling?
I was indeed. I mean, I do think that, yes, it's very difficult, and the lockdown has been imposed nationally. We've had no say in it, but I do think we need to, both as councillors and through networks, let people know that a lot of traders are still able to trade in different ways. We're doing some work around, and perhaps Mark would like to come back on that, around facilitating online shopping for our local stores, and the click and collect. It is still permitted, you know, to order goods online and go and collect them rather than having to go through the postal system. I know it's very difficult, and I don't want to in any way diminish that. Just down the road from me, the local hairdressers were working till very late last night to cover demand, knowing they're going to be shut. Indeed, the barbers just around the corner from there had a long queue last night. And I do appreciate those businesses are closing with, you know, it's not great for them at all. They've already had a big closure, but there are ways that, you know, that some other business can be helped. And I don't know, Mark, whether you just want to say more about some of the facilities we've got and some of the work we've done in terms of online and helping people go online.
Yes, so thanks, Don. That's a very good point. Nailsy have been brilliant. Nailsy have already set up their high street online, and you can shop on a lot of your high street shops online. Weston was sadly supposed to go live tomorrow, but obviously that has now been delayed. But there are still many shops that you can still shop on in our high streets online, and go and search them out. And there are some schemes now, and I think Weston-super-Mare will have this scheme in place pretty quickly, where you can then go and collect the goods from a site which you will be told about when you ordered. So it might be at a specific site in the Sovereign Centre, but you better pay for your goods and then go and collect them, so you don't necessarily have them sent to you. But it is something we're progressing, because we don't know what position we're going to be in over the winter period, and we are working hard with our retailers and businesses to see how we can sort of facilitate more of this online type of trading in our high streets still, so we don't end up ruining our own high streets.
Absolutely brilliant. Thanks, Mark. And just to reiterate what you said earlier, the most important thing is to try and spend local and support local businesses. And if you can hold off until later or order online using a local independent, please do. So the next question is from Claire, and this one's for you, Mike. And Claire wants to just remind people about the community support that's available for people, including those who are isolating and so on. And really applauding those that have done such a great job since March. Do you want to just say something about North Somerset Together and the work that we're doing to support that?
Certainly, North Somerset Together as a group of community volunteers have been fantastic throughout this. They're supporting over 7,000 people and our most vulnerable people that are finding it difficult, older people. They're giving a tremendous amount of support throughout, and they're supporting things like collecting prescriptions, helping with shopping, just social things as well. So they're giving an enormous amount of help, and there are some contact details that I can give for anybody that wants to find where their local help is going to come from. The telephone number is 01934 427 437. So that's 01934 427 437. And there is a link to the website through our North Somerset, which is www.n-somerset.gov.uk/together. And that will also point you towards anybody that can help and support in your area. So they've been running right the way through from March. They've been doing an incredible job, and they're still there to support our vulnerable older and even younger vulnerable people. So please use them, and they will help support you. Thank you.
Super, thanks, Mike, and we'll make sure that those details are in the comments as well. Catherine, you wanted to come in.
Yes, I just wanted to come in and sort of reiterate everything Mike said. Mike and I think Councillor Bridger, were involved with this from day one when it was set up, and we volunteered to be the community champions for this. So I've attended virtually every meeting of the network leads, and it is absolutely remarkable what our communities have achieved in such a short space of time in drawing together all the different strands and elements of help within the community. And I just want to particularly sort of give a shout out to the fact that it's North Somerset Together and many of the groups there that stepped up and helped us with the free school meals over the half-term period, which was something disappointingly, the government didn't do, but we already had those structures in place. And we as a council, through additional funding that we've given them, have been able to use those networks and support all of our children over that period that needed it. And it just goes to show that you, the people of North Somerset, really can work together and make a massive difference.
Brilliant, thank you, Catherine. So the next question is from Anne, who is just expressing a concern about social care staff. So this is staff who might be employed by a service provider being furloughed when a service user might return home to be with their family during the lockdown. And her concern is that that's putting jobs at risk and potentially losing access to experienced care staff. I mean, that's a really good point. You'll appreciate, of course, Anne, that social care staff, whether directly employed by the council or by other service providers, or indeed by people needing care themselves, have been under immense pressure right through the crisis in terms of the need to provide PPE, to provide access to their clients in a safe way, and unfortunately they haven't been immune to some of those pressures. So I can understand why some service providers are finding themselves in a position where they need to furlough some staff. But that's a really key point that you've raised, and I'll take that away and talk to our social care team and commissioning managers about how we can make sure that that kind of thing is avoided and we minimise the risks of losing critical skills, because people working in care have never been more important, and their critical role has never been more emphasised than it has been during this COVID-19 crisis, and we need to reward and recognise them much more strongly than we have before, and that's something that we're certainly committed to doing as a council. So I've got a couple of related questions from Simon and Richard, which I'm going to throw at you, Matt, if that's okay. So Simon wants to know whether you can visit a vulnerable relative if they live a long way away, so if they're 200 miles away. And Richard wants to know whether the COVID testing centres will be open throughout the lockdown.
Okay, so just to confirm that the COVID testing centres will remain open. So it's really important that if people have symptoms that they still go and book in for a test, and hopefully the access to that testing provision is improved over recent weeks and people are being able to get that either at the airport or at the sites in Clevedon and Weston-super-Mare. In terms of visiting a relative a long way away, so the social contact that people are meant to have is within the bubble if they form a bubble with another household. So I'm not quite sure of the circumstances. You're meant to only form one bubble, so it will depend on the circumstances for that individual and whether the vulnerable relative who may live some distance away is the nominated bubble for that person. So what I would say again is just check through the guidance and be clear about how many links you can form. Generally, if there is a vulnerable person, you can form a link with that, but it should be with one other group only. So please double check the guidance, but essentially that's the way it's being handled.
Thank you, Matt. And my next question is from Nigel. So he's asking about the treatment of people with COVID symptoms who are either in care homes or being transferred into care homes from hospital settings, and he's asking the question, why are care homes not able to treat and support those with mild symptoms rather than adding to the pressure on the NHS? So I don't know if you want to comment on that, Matt, but I think overall the work that our local care homes have done has been absolutely exemplary in terms of trying to manage and protect the residents living in their care homes who are clearly at most risk of dying from COVID or having lasting health impacts from catching COVID. And I think they've worked extremely well with the hospital both in Weston and in Bristol in terms of managing discharge and supporting patients. But you're absolutely right, everything is changing all the time and there are lots of new ways of doing things, and one of the things that's absolutely being looked at now is how some patients with COVID can be discharged safely into care homes, and that I think the suggestion at the moment is that there will be a dedicated designated care facility which patients can be discharged into, so there's not the risk of cross-contamination to other COVID-free residents, but where there is an opportunity to get people out of hospital quicker if it's safe to do so. But Matt, is that a fair reflection?
I think that is, Mike. I think the key thing is it's a clinical assessment of each individual person. So, for example, going from a care home potentially into hospital, so that will be led primarily by the GP, making an assessment and a recommendation about what should happen. And they will be dynamically risk assessing all the time. You know, what are the symptoms? How is that condition being treated? And if somebody's situation starts to deteriorate, then they may think that's an appropriate course of action. And similarly, coming back out of hospital and into a COVID secure setting, so people would be put into a space where they could be isolated and not put other people at risk of potentially contracting COVID if they're still, you know, in a period where they could be infectious. Then you would do the same risk assessment. You would only be discharging someone from a hospital setting when it was clinically appropriate to do so. So I think we just have to trust in our local clinicians who are doing a fantastic job in making those judgments and trying to act in the best interests of each individual.
Thanks, Matt. And a couple of other questions which I'm going to direct at you, Matt, this time as well. So Tony, and they're related really, about death rates and case numbers of COVID at the moment. So Tony is a funeral director, and he's making the point that there's been very few COVID deaths, particularly recently. So whether you've got any thoughts on that and what that tells us, and also another Tony actually wants to know how many new cases we've had this week and how that's changed over time. So particularly interested in the rate of change, because I think there were some reports today that in London they've started to see a reduction in the rate of increase, which perhaps suggests that some of the restrictions have had a positive impact. So perhaps you can comment on what we've seen over time here in North Somerset.
Sure. So we've seen an increase in cases. So I think I mentioned at the start, 368 cases over the last 7 days. So about 50 a day is roughly what we're at. If we think back to maybe a month ago, it was a lot less than that. It was somewhere between 10 and 20. So we have seen a rise in cases over a period of time. You know, and we probably would expect that to continue to rise in the short term. So although the restrictions are coming in today, there tends to be a bit of a time lag, which again would point to that fact that London put some additional restrictions in earlier. So therefore you start to see a dividend maybe a week or two after that point. It takes a little while to work through the system. In terms of deaths, it's certainly true that we've had a lot less deaths so far in this second wave as opposed to the first wave. I think a lot of the deaths in the first wave, very sadly, were associated with care home settings, and there were some risks within that environment, which, you know, as we know, were particularly challenging around the use of PPE and the discharge of patients into care homes who may be infectious, and then large-scale outbreaks in those settings. I think this time around we're in a different position where we have a much securer position around PPE. We have a much better sort of network of support around care homes to try and help them keep their residents and their staff as COVID safe as possible. But I think we will have to see over time whether, you know, if the cases still go up, and that may still happen over a period of, you know, 1, 2, 3 weeks potentially before they start to come down again. It tends to be a time lag between the cases, hospitalizations, and then deaths. So we may well see some more deaths over the next while, but hopefully that will be at a much lower scale than we saw in the first wave. But clearly that's part of the motivation for the changes that we're seeing coming in today, is a concern that if you start to overwhelm a health and social care system, you put more risk into the system full stop, not just in a hospital setting, but also in the community. You know, are people going to step forward and seek care? We definitely want them to and encourage them to do that at all times. But you get a kind of cumulative effect of people with infection, but also other harms that come through as well. But COVID deaths is something we're keeping a very close eye on and doing everything we can to try and avoid.
Thanks, Matt. And I think that it's interesting, isn't it? Because it's one of those points that a few people have mentioned to me around the relatively small number of deaths and whether we're all just getting it out of control and overreacting. You know, my view is that if we had had an incident in North Somerset in the last 6 months that had caused the deaths of at least 150 people and potentially many more than that, and lasting effects on the health of many others, we would be up in arms. We'd be calling for public inquiries. There, it would be, you know, headline news, and we would absolutely be expecting action to be taken. And that's exactly what has happened. You know, that is exactly what COVID has delivered so far. And it's only because of the measures and the actions that has been taken by us all as a community that we've been able to keep that death rate down. And that's not something to criticize and challenge people about. That's something to, you know, to say, let's keep at it and keep that death rate as low as possible, because that's what it's all supposed to be about. And I think equally there is an issue about the perception that we are a low case rate area, and that the Southwest has been somehow immune to the effects of COVID, and it's all about students and it's all about the north of England. You know, the fact is that in a very short period of time, the COVID rate in North Somerset has risen from, you know, well below the national average and regional average to now testing that, exceeding the regional average and reaching the national average. So it's absolutely grown over the last few weeks, and we have to take it seriously and do the right thing to get that case rate down, to protect people, the NHS, save lives, and be able to get our economy and our lives back on track the way we want. Catherine, you wanted to come in.
Yes, I just wanted to make the point. I mean, a couple of people have said to me recently that, oh, you know, we're going into lockdown. I'm going to be stuck at home anyway. If I feel a bit unwell and I have some symptoms, there's not really any point in my getting a test because I'm staying home anyway. And I think that's completely wrong. I think absolutely, if you do suspect that you might have relevant symptoms, even if you are stuck at home, as they put it, you should still go and get a test. You should act in exactly the same responsible manner as before we entered this short lockdown. Just because it's short, we hope, that doesn't mean to say that we shouldn't be additionally vigilant. The other thing I wanted to ask Matt is whether he would agree that as we learn these new behaviours and we are much more attuned to the hand washing and general levels of hygiene that we need to keep as individuals, and with the face coverings, do you think that we will have a reduction in the transmission of the other diseases that we normally expect at this time of year? Because it might actually lead to a lower level of normal flu infections, which could perhaps be an additional positive. Even if you're not at risk of getting COVID, or you think you're not, you will still help the NHS by observing these behaviours, because you may not be spreading other things which will release pressure. Would you agree that that's the case?
Yeah, I think you make a very good point there. There's a potential dividend all round for health and well-being in our population. In the same way, for example, we were hearing today about the significant number of people, additional people who've got the flu vaccination this year. So that's a really positive thing too. So, you know, this is not the situation we would design by any means at all, but if it helps us to learn new behaviours that help us to protect each other, and let's be honest, you know, vulnerable and older people, lots of vulnerable and older people die each year from things like flu or other infectious diseases. So everything we can do to try and break that chain of transmission through simple principles and just being thoughtful about the way we do things is going to be of benefit. So yes, I guess we're learning to live differently in all kinds of ways, and that would be some of those protective behaviours with things we'd like to hold on to for some time to come, I think.
Thank you, Matt. Right, we've got 15 minutes left and quite a few questions to get through, so we'll try and fast track some now, please, colleagues. So Luann wants to highlight a group that she organises to support people with hidden disabilities, and it's a Zoom support group. So I think the answer to that, Mike Solomon, will be please let us know about it and we'll make sure we spread the word through North Somerset together. You can give me a thumbs up if that's fair enough. Yeah, he's thumbs up. So let's have the details, Luann, and we'll certainly spread the word on that. Martin wants to suggest, who wants to take this one? Mark Caniford. Martin wants to suggest free parking when we come out of the restrictions in order to boost the economy and get people back out shopping again.
Yep. not my responsibility any longer. However, I think it would be a great idea. There is always one problem with free parking, Matt, and that is the simple fact that everybody will park there all day and you won't get anybody into the town shopping because they won't be able to find a parking space. So it is trying to find a balance and trying to encourage people into the town. You're quite right. Is that the solution? Well, we'll have to have the discussion. I'm not sure whether it is totally the solution, but I hope we can do some free parking over the Christmas period to help regenerate our towns.
Great, thank you, Mark. And I've got one for you, Don, from Nadine, who says, are you moving to 3 weekly bin collections as they've done in Somerset?
Why are these questions on waste? The person in charge of waste isn't here. We do have, interestingly, one of the best recycling rates in the country, certainly amongst unitary councils. I did notice that the Somerset change to 3 weekly was prefaced on them changing their recycling to only the system that we have from a previously a much lower level of collection of recycled materials. So I would say if the precedent is being set in Somerset, it's something you'd have to very, very, very seriously consider, because we do have obligations under government legislation in the recycling and reusing, and I think we're all very keen as a council to push that agenda forward. And of course, we want to stop putting stuff in that either has to go to landfill or for incineration. We need as a country to produce far less waste that can't be in any way recycled. So I think it'd be interesting to see what happens in Somerset, and we'll have to seriously consider the implications from it. I appreciate there are certain people who find it very difficult. I'm thinking of people with medical waste and the like of that. So I don't think it's a simple all cases fit. People living in flats and smaller houses clearly have lots of issues in terms of storage. If you ask me personally, I reckon I could go for 4 weekly, but then again, I may not be representative of everybody. But recycle, reuse as much as possible, I think is the answer.
This is one of those moments where you want to be able to mute your colleagues. But just before we set any hairs running, the focus at the moment is bringing the waste and recycling service back in-house, and bringing to an end the contract that we've got with Biffa. And under those proposals at the moment, there are no plans to move to 3 weekly recycling. The focus will be about getting the operation back in-house and getting it working efficiently and effectively as it should be and as residents expect. So any other issues that we might look at in the future are very much for the future. So just to give that reassurance, don't think that there's going to be an imminent decision around the frequency of collections. Okay, I've got a question for Catherine. Emma Jane wants to know about COVID cases in schools, and obviously some schools have had to close for some year groups, and she wants to know, are there plans to shut other schools? What are your views on schools being open at the moment, and are some of the bubbles and other arrangements in secondary schools right?
Yes, okay, yes, some of our schools have had cases and they have had to send year groups home, and that's only right. Obviously, that's the guidance. If you have a number of people exposed to somebody who's tested positive, yep, that happens. In terms of schools remaining open, I would say, as alluded to before, here in North Somerset, we were thinking about moving into the next tier up before the government announced this short lockdown. And under that ruling, our schools would have stayed open. And I think given the situation we have in this area, I absolutely support schools staying open. I can understand some of the unions' concerns when they're thinking about areas like Liverpool or Manchester, where really the level of infections, the R number, is very high. I can see why teachers and staff are concerned, but I think I'm confident in North Somerset, as we are at the moment, that is absolutely the right thing, because it's very important for our children to keep up with their education. I think there's a lot of people that suffer hugely, young people, that is, in terms of losing their impetus in their education, and mental health issues with not being able to mix with their peers, their friends. So I'm pleased that they are staying open. And I'm also pleased that the government has finally given some stronger or clearer advice on face coverings. So now we know that face coverings in communal areas will be required by staff and pupils of year 7 and above. I personally would have been more comfortable perhaps if we'd followed Scotland and made face coverings mandatory in the classroom as well. But we haven't, and let's just hope that the situation we have will keep our students safe as best we can. What was the other part of the question? I might have waffled on about other things too long.
I think you've covered it, Catherine.
Have I? Okay, yes, right, thank you.
And just to take the opportunity, actually, just to reinforce a message that we tried to put out earlier in the week, and that is, please do think about how you can go the extra mile and add value to the restrictions and the things that you're doing. Don't feel that the national restrictions are the maximum that you need to be doing. See them very much as the minimum. So if you can do extra things in terms of keeping your distance from others, wearing face coverings in situations where you're likely to come into contact with others, please do that, and particularly in crowded areas. So, if you're like me, a primary school parent, and you're picking up after school, remember to keep your distance, wear a face covering if it's sensible, and try and just go the extra mile, because the sooner that we can bring these case numbers down, the better it will be for all of us.
Yeah.
So
that's absolutely right, Mike. Yeah, thank you for saying that about the pickup point. I was going to mention that later on. Yeah.
So question for Don from Alan, who says that on a previous Facebook Live, you mentioned that there were something like 4,000 excellent planning permissions for homes to be built in North Somerset that hadn't been built by developers. Is that true? So I guess he's giving you an opportunity to comment on this one.
Well, yeah, well, the answer to that question, Alan, is yes. I think it's about 3,700. So the 4,000 is roughly where it is. And the frustration, of course, is that we are being forced to build more and more and more houses. I mean, the current number could be 20,000 plus for the next 15-year period with the Newton algorithm the government has imposed upon us. And of course, that means that we have to then give permissions for beyond that 3,700 number. So it's desperately frustrating for communities that the permissions have been granted and houses aren't built. I did suggest to some colleagues that, not in North Somerset but beyond, that the best thing to do would be to add to the planning permission that any houses not completed within 3 years of grant, we should be able to charge the person having that planning permission council tax at band D on all properties. Now, of course, that would be a really, really good idea, because it would bring some money into communities and actually get people to build more quickly. But I won't say, but certain political parties, of course, receive an awful lot of funding from the house builders. So that scheme never got very, very far in terms of being put into international legislation. That's kind of the challenge we have, that we have no ability to, once those permissions have been granted, to even force the people with the permission to build. And then we have the situation where we're being held to ransom to build inappropriate housing in places we don't necessarily want to go. The other issue, of course, is around it, and I'm sure Alan, if it's the same Alan, I think it is, we had this question before. The other issue we have desperately in North Somerset is what sort of housing do we want to build? And for me, within my ward, and I guess colleagues will be much the same, there are probably 3 pressures which the volume house builders don't want to address in really any way, shape or form, which is relatively small houses for people to buy, for first-time buyers, affordable rental property for the residents of North Somerset, of which there are many thousands who are in very desperate need of affordable accommodation. And the third one is for people who are in very large houses, who for desperately important family reasons wish to stay within their communities and cannot downsize into more suitable accommodation as they get older. Because clearly the large family house you might have had 20 years ago doesn't suit well when you're becoming more infirm and you wish to have something much more appropriate for your needs. And those are the ones I very, very rarely see the volume builders providing. So you ask a very good question. I'm sorry if I've gone on a little bit about it, but it is part of a far bigger, completely dysfunctional housing market that we have in this country that does need fixing, but vested political interests are often preventing us from doing that. Thank you.
Thank you, Don. And the next question I've got is from Chris. I'm going to direct this at you, Mike, and that is about government support for tourism and the hospitality sector. Has it been good enough? Lots of tourism businesses particularly seem to have been struggling despite a reasonably good summer. What more do you think the government should be doing?
Yeah, that's a difficult one actually, because there has been support out there, and there's only so much money that we can borrow to keep supporting the hospitality industry. They've had the whole help with the furlough, and it's really good news that the furlough is now being stretched on to March, which is going to help a lot of the hospitality industry. It's notoriously quite a low-paid industry anyway. So it's very difficult for people in that industry. They've allowed takeaway, which is really excellent. It means that businesses that would be struggling now to see any income at all will now be able to run some form of takeaway business, which will obviously help. So I think in terms of the help that they've given so far, it has been very good. Obviously, if there's any more that can be done, it should be done, because we will see maybe some of the newer hospitality businesses, the smaller ones that may have only just started and had large borrowing, we might see them struggling in a big way, whereas the more traditional ones that have been in business for the last maybe 100 years, restaurants, cafes, bars, pubs, possibly no mortgages to pay, etc., they tend to fare better. So in terms of that industry, it's one of the ones that's being hit incredibly hard, and especially considering they were just getting back on their feet. I could see that they were starting to buzz again, that people, they had the right conditions in place for COVID, most of them. I know we had a few exceptions, but most of them. And they were just starting, the staff were back at work, they were getting excited, and all of a sudden, through no fault of our own, or through some fault of our own in terms of people that haven't really bothered to follow the COVID rulings, we're now back to another lockdown, which is going to hit them extremely hard. So I am concerned about them, yes.
Thanks, Mike. And Mark, keep it brief.
And just I'll keep it very brief, and just remember that those businesses that have to shut down, who are, even if you do takeaway still, you will be entitled to grant if it severely impacts on your business. So keep an eye open for that link, get those grant applications in. There won't be an application form, but get that grant request in. You will be supported.
Great, thanks, Mark. So I've got a couple more questions I'm going to deal with really quickly. So Anita was asking about the clinical extremely vulnerable list and who's on it, because it's not totally clear from the government website. The government will write directly to everybody who is on the list, and North Somerset is going to do the same. So the council is going to do the same. So even if it's not clear to you, you should be contacted directly by government, NHS, and by the council if you are on the clinically extremely vulnerable list, to advise on the support that's available and what you need to do during the national restrictions and beyond. So hopefully that will help, Anita. Dawn and Michael have both asked about homelessness and what support's going to be available. So if there's any specific cases, please do contact me or our housing team, and we'll see what we can do to support. In general terms, the government has announced today some additional funding to ensure that people sleeping rough are off the streets and supported appropriately, as happened earlier in the year. Don led our housing team very successfully in terms of getting a large number of rough sleepers into accommodation in the early lockdown and early part of the pandemic, and did a great job. And we're absolutely determined to continue that through this period and the winter. And then the last one I'm going to take is Suzanne, who's asking about the restricted access signs that have been put up on Valley Road, which is impacting on access to Clevedon School. There's no one on this meeting that can deal with that directly, but we'll definitely take that away and look into it. And if you want to email one of us with your contact details, we'll come back to you with a response. Right, so we've managed to get through. Go on, Catherine, you've got your hand. You're going to be cheeky. Can you wrap up and give me any final remarks whilst you do it?
I just wanted to mention the Night Assessment Centre for the Homeless and say that it's actually not open because of government guidelines on places like that. They're not allowing hostels to open. So people often ask why people can't go there. So I just wanted to pop that in there. Do you want me to make my final remarks as well?
Well, just to add on that the government guidelines have shifted a bit on night shelters, and we are absolutely working with the night assessment shelter in Weston to get them back open again. So we are going to wrap up now. Thank you very much for listening. Those of you that have stayed with us for an hour, well done. And I'm just going to invite my colleagues to make any final remarks that they might want to, just in case there's any messages that they want to convey. And just to say as well that this recording will be made available on our YouTube channel afterwards with subtitles. Unfortunately, we've not been able to make it as accessible as we would like on the Facebook Lives, but you can view it and share it with your friends should they be looking for some entertainment during this lockdown too. On our YouTube channel. So Catherine, would you like to say any final remarks?
Yes, I suppose I'd just like to say that in terms of children's services, despite the lockdown, it is business as usual as far as possible, with the exception of our children's centres, which are not open apart for appointments and midwifery. But anything else, I wouldn't want people to feel that they have to hold off with contacting children's services with any concerns till the end of lockdown, because that's absolutely not the case. If you have any worries or concerns, or you need to speak to anyone within the children's services team, it is absolutely business as usual. And please don't hesitate and feel that you've got to wait till the 2nd of December to deal with any issues, because that's not the case. I would say our teams have worked really hard and put in place all sorts of ways of working, and are pretty experienced at dealing with the current situation now. And I'd say the same of our schools. So let's just try and get through this next 4 weeks in the best possible way. And remember the guidelines, the face mask wearing, the measures of washing your hands, keeping your distance from people, and we'll all hopefully have a happy Christmas to look forward to.
Thanks, Catherine. Not quite the first mention of the Christmas word, was it? Mike.
Yes, just remember North Somerset Together. They're there to support people, the vulnerable people going forward. So never think you're alone. Never think you can't get help to do your shopping and to collect your prescriptions. There are lots of people out there ready to help you. Thank you.
Thank you, Mike. And Mark?
Same message as you would expect. This is the support there for you. North Somerset will be issuing that support as soon as we can. Just make sure you contact us and spread it amongst your business colleagues and friends. And on the 2nd of December, let's go and revive our high streets.
Super stuff. Thank you. And Matt, any final thoughts from you? I was going to say an uplifting message, but maybe a sobering one would be more appropriate.
Well, it's probably just to say thank you. We hear a lot about what things aren't being done well, but thank you to everybody who has worked really hard with the good behaviours. Stick with it. It will definitely be worth it if we can bring the cases down and reduce the effect on our community. So thank you for that, and keep being kind to each other, because that makes a huge difference.
Thank you, Matt. And Don.
Thank you for everybody for watching, either on the recording or live. I think it's great to have so many questions and so much interest from the public of North Somerset. On that point, I think I'd like to thank, I'm sure on behalf of not only the executive and the council, but also all the residents of North Somerset, our key workers. I mean, we've got very many key workers within our council services, but beyond that, how do we get those food deliveries, a post, medical. There are so many things that are being done by people who have gone beyond the call of duty in most instances over this very long period. And those key workers have been with us since the very beginning. So I think that my support for them is enormous. And I'm sure on behalf of thank you for everything you're doing and will continue to do, I know, for the next probably several months to help us get through this. And also, with my hat of chair of the fire authority, I think I also ought to say, please, please, please be careful tonight on behalf of all those firefighters who are out there waiting, but hopefully not coming out. So please be careful. It's for your own safety. Exciting as fireworks are, they also are extremely dangerous. On that note, I will pass back to Mike and thank you for his comparing duties. Our very own Carol Vorderman.
All right, steady. And I don't get paid as much as Carol Vorderman. Thank you very much, everyone, for watching. Thank you to my colleagues for participating. And we'll be back with another Facebook Live at some point towards the end of or in the early part of December. Thanks for watching and stay safe, everyone.
Thank you. Stay safe. Bye.